Hi, everyone. Welcome to the TROHN Learning Community. Today we have a special treat. I have a panel of experts in recovery housing that we're going to kind of have some discussion and have some prepared questions, but we will be open to Q&A. So feel free at any time during this panel discussion to ask questions. That's what we're here for. And the more questions we have, the better content we get in these panel discussions. So, without further ado, my name is Jason Pullen. I'm the executive director of the Texas Recovery Oriented Housing Network. We are the NAR affiliate in Texas, which is the National Alliance of Recovery Residences. And if you've made it to this meeting, we had some kind of communication, and I probably directed you here or you found it on our website. But either way, welcome to the meeting. We're glad you're here. Today, we have a panel of experts, and we're going to be discussing some of the things to consider when you've decided to go ahead and open a recovery home, or maybe you're an operator who's already open, but you might be having those freshman struggles, if you will, and that all of the people that are experienced operators on this call know about, including myself. I spent some time in operations for several years with a large organization, and even the large organizations run into some of those issues. So, without further ado, I'm going to go ahead and start the introductions. And panelists, if you will, when I call on you, just introduce yourself and tell me, a couple of minutes, tell me about your experience in and operating recovery housing. So I'm going to start over here with Darren Morris. Darren's from Houston. Darren, introduce yourself. Tell me about it.
Hi, good morning, everybody. My name's Darren Morris. I'm the owner of Riverside Recovery House, which is a sober home that is just south of downtown Houston. We house up to seven men at a time, plus the guy that lives there. Um, so there's eight in the house that we can hold up to eight at a time. Um, that home was a house that I lived in. I purchased for myself to live in 2017, and then a couple of years later, decided that I didn't need that big house by myself anymore, and I had a good friend of mine in recovery that came to me with pretty much a business plan, and we sat down and chatted about what it would look like to make him the house manager and have him live there while he took care of managing the day-to-day operations. And so I pretty much take care of all the bills and paying the bills, and he keeps the house full or as full as possible, and takes care of all the issues that come up as they do from day to day. And I'm very lucky to have him on my team because I don't even live in Houston anymore. I live up in Conroe. So it's a good thing that he's around for that day to day operations. But we just celebrated our 4 year anniversary. And like you said, Jason, getting off the ground is always a spooky thing. I think it's good to have support and people around you that have done it before and kind of know what they're doing. Um, One of the examples that I have was I had the wrong insurance in place for a couple of years until I started talking with Jason about becoming certified. And so I'm really happy that I have the right insurance in place now. It makes me sleep a little better at night. But I'm happy to be here and contributing. Thank you.
Thank you, Darren. Appreciate you. And I'll move on over to the Dallas side of things, DFW area, and Jennifer.
Hi, everyone. I'm Jennifer Da Silva. I'm the executive director for Simply Grace. I'm not the founder. They opened as a nonprofit in 2011 and started their first home in 2013. I moved into operations in 2019, and then I've been executive director now for a little over 4 years. About us, I am a person in long-term recovery myself, almost 12 years. and also have the fun mental health struggles that come with ADHD, anxiety, and depression as well, which is fun, but connectable, right? I can connect. I understand where they're coming from. I know what they're going through. Um, I'm not going to get into my journey, but I've been there and done that with the record, with no car, so I can suggest things that they may not realize I've had that experience in. So we have five women's sober living homes: Fort Worth, Dallas, Richardson, two in Plano. One of the Plano homes is a mommy and me for women with children, 2 to 12. We considered doing younger, it didn't work. Um, she lived there for like 2 days and left and relapsed. And having a child and relapsing and reporting is terrifying. And worrying about if that baby's going to be alive in the morning. Honestly, that's some of the things that we work with. We also have the IOP and Counseling Center here in Richardson and a thrift store next door to support. We're a nonprofit organization as well. So it's been exciting, challenging, fun, hard, all the things. Um, I don't know how much more you really want me to talk on that, Jason, but that's really the quick rundown. We are in network with many insurance providers for IOP. They don't have to do our IOP to live in the house, and they don't have to live in the house to do our IOP. They're run separately. We are super high accountability. If you ever hear Simply Grace sucks, their rules are hard, this is ridiculous, it's true. We are hard. And they sign up for it. So when it doesn't work, we do ask them to leave. Zero tolerance policies, UAs, breathalyzers. We have a relationship with Millennium Healthcare for lab to confirm results to make sure that we are doing the right thing. And if we're wrong, we make it right. We all are in recovery. We work a strong program independently to guide these women to their path. And our empowerment looks like empowering them to do it themselves, not us saying, great job, you're doing wonderful. It's us saying, hey, would you consider looking at this differently? So very high accountable. Um, and they can do a different IOP. They don't have to do ours, but we're going to follow whatever treatment is required upon discharge from wherever they're coming from. So we hold them accountable to that. But yeah, that's about it. We have some really cool events. Our biggest fundraiser is Recovery's Got Talent. We have a lot of fun. People in recovery try out. We pick the top 8, and it's a fun competition. And that is held usually in March. This coming up year, it's April 16th. Mark your calendars. Fun,
We
fun.
will. Thank you, Jennifer. I appreciate that. And now moving over to the Hill Country, we've got Curtis. Curtis, introduce yourself.
All right. Thank you, Jason. My name's Curtis Potter. I am the director of Mastermind Recovery. We are a nonprofit. We are a 12-step program plus optional faith-based, so it makes it a little different where we actually provide transportation to Bible study and church and count it towards their meeting requirements. We've got 6 houses in San Antonio, 3 men, 2 women, and a women and children. Then we have 2 men's houses north of Dallas and Richardson. We've been open about 3 years, and I guess what makes us a little different, of course, the faith-based aspect, but we also have a lot of extra support. We have full-time case managers, and back to like empowerment, like Jennifer said, the case managers aren't doing everything for the clients, but they're uh, helping them make a plan of action and giving them the resources they need and holding them accountable and supporting them in the reentry process. So our case managers meet with the clients weekly. Initially, they go through everything, like we provide bus passes until they get their first paycheck, employment resources, make sure they get their food stamp card, cell phone if needed, things like that. They put together a list for them when they get in, and then every week they meet with them in person with a phone call in between until they have a job. They're working, they have a sponsor working a program of recovery, and they've completed all their goals. So that process typically takes 3 to 4 weeks. Some people get it done in a week or less if they're really on it. But basically, we're just kind of helping them in that reentry process. So um, happy to be here.
Thank you, Curtis. And Curtis, how long has Mastermind Recovery been open as far as the homes?
We hit 3 years in July.
3 years. Wow. It's unbelievable. I can remember when we first started talking. And I have been in all of your homes this year. So that's my privilege as I get to travel all over the state going to visit you. And it seems like we have a diverse group. We've got a group of women's homes and we've got a whole group of uh, men's and women's homes and a faith-based program. And then we have a single operator that's thriving for 4 years with the one home. So um, glad we have this group, and I'm just going to jump in with our first question. So the first question, and I'll call on each of you, is what should a prospective provider consider before opening a recovery home? And just like narrow it to one or two things, like some of the most important things they need to consider before jumping into this wonderful industry. And I'll start with you, Curtis.
Okay. Well, I think one of the major things is deciding what type of home, typically people start with one home. So like what type of home are you going to run? Is it going to be 12 step? Are you going to be open to other, means of treatment, right? Are you going to, uh, cater to people? Are you, and like, what are the requirements to come in, right? Are you going to require ID or not? Are you requiring a particular length of sobriety? Like we require 30 days sobriety, or will you take people straight out of detox? And of course the just the outline of the program, right? Like the accountability, like meetings, drug tests, just all the structure, thinking about those things, I think are all important.
Okay. Well, and Darren, what about you? What would you say that if someone were to open a home, the things that they should consider uh, you opening? I was talking to a provider today that runs a group of homes in San Antonio, and he said, he learned by other people or his own mistakes, and he's got a lot more failures than he does successes from the early times. So, what can you tell me if you were talking to a new operator? I came to you and said, "Hey, I want to open a sober living." What would you tell me?
Well, I've had this conversation with quite a few people because I do get asked that a lot, and I really would like to know what their underlying motivation is for the home. And if it starts with the words profit, I think that I that's probably the conversation is going to be real short at that point because over the 4 years, yes, we are staying afloat, and we do have a savings account that we have, but there's definitely not. I mean, we're not nonprofit, and so I there are homes out there that work on the other realm of the for-profit side. I'm putting that in quotations because there's definitely not a profit that happens over there. So what is the underlying motivation? And if that is, I'm wanting to help people have a great start in their first, part of recovery. That's where we can start. Like, okay, let's make a plan of where are you looking? Is the house going to be safe? Are you in a safe location in the city? So that the people that live there, are they going to feel safe while they're there? I think that's pretty important. Um, and also with that location that you're looking for a home, is it close to, in Houston at least, needs to be close to public transportation, a bus stop, because I know in the bigger cities, you could be, you know, 20, 30 minutes away from your job on the bus, and there's no way to really get there unless you have access to public transportation. And another thing would be maybe just like Curtis was talking about, maybe you could find a niche that worked really well for you. I know our sober house is geared towards the um, gay section, and there's really not that many that are in town, not that many in Texas, I've noticed. And so we have that niche going on. and gay and trans at least. And so, just to have somewhere for that specific part of the community to have a place to come and recover right after they get sober. There's really not that many out there. So if you can find that niche and that can be part of your marketing to attract more people to come into your home, I think that's important too.
Thanks, Darren. And I'll pass it on over to Jennifer. What would you tell me?
I see what you did there, Jason. You left me with the hard one because they already gave you six. In my experience and what I've learned over the last 6 years is, and if I were to consider opening my own personal home, or anybody I would tell now, is that you have to be professionally equipped, passion, and being in recovery, and all of those things are great and they help to be able to connect. Um, they don't help in the business aspect of it, strategic planning, um, accounting, finances. Um, can you separate personal and professional? These are things that I'm learning or have learned in my process, is that I can be passionate and say the wrong thing, the wrong word, the wrong face, and it can be taken differently than intended. So, maybe somebody who has some education in learning how to control itself. We're not supposed to control and manage, but we're supposed to control and manage in this scenario, right? Like we
Right.
need to be able to know how to be a leader. We need to know how to keep a safe environment for everybody as far as toxicity. It can go south really fast. And usually if it's gone bad for too long, it's really difficult to come back from. So yeah, I think a business perspective, some have a mentor specifically that you look towards for guidance, support, professional development, and education, and education in many areas, right? Like we've got to have strategic planning, and we have to have a sustainability plan. There's so many things that are required when you get into the nitty gritty of it, of managing and running, that sometimes I don't know if people realize that there is a lot of extra work that we don't think is going to come that comes. It's better to be prepared than to get prepared because it's hard lessons.
Right. Thank you, Jennifer. So, and all great answers, starting off with your motivation. Darren shared about the purpose and motivation, and having an idea of a niche or a program model, are all key things before even looking for homes, I would say. One of the things that I always ask people when they call me up with this idea is, what is your connection to the recovery community? Unfortunately, or fortunately, it is really hard to start an organization, a sober living home, or a group of homes without some sort of connection to that community, because others out there have that connection and people go with what they know. So if I had no connection to the recovery community, then it would be really hard to get started. Even as a person in recovery, I know that when I opened facilities in Houston, it took a very long time to gain trust of the referral sources. Even though I was visiting them, bringing them lunch, meeting them at the networking group meetings, it took me a good 6 to 9 months before they would send me anyone. And that's just how it went. Other than the homeless population, which is exploding everywhere, that was really the tough part, is get the referral sources to trust you. So, great answers and considerations. So I'll move on, and Jennifer, I'll let you answer first on this one since you came in with the strong in answer. And Darren touched on it a little bit, but what important things should you consider when you're picking out a location?
I think that the main important factor for us is the transportation aspect, being on a bus line, near a bus line, or having a connection with Lyft or Uber or some of these other rideshare apps to provide the basic necessities. The neighborhood and the area. It depends on your dynamics and the culture that you want to serve of where you want to be, and make sure that it's a safe place for that population. What I might think is a safe place, somebody else might not, and vice versa. So depending on what population I want to work with, I want to be in the area that they're comfortable in. Making sure that, neighbors or surroundings are not bars and clubs. And if it's suburban, great. If it's in the city, what part of the city is closest to those meetings that we want them to go to, or church that they, if it's going to be faith-based, like what is around, what's easily accessible. Primarily somewhere where it's not overpopulated and dangerous, but where jobs are easily attainable. And recovery jobs, first time jobs, great, but also just like for a good long-term job, because it's going to take a year, sometimes two, for someone to feel comfortable to move out successfully and be, self-sufficient and self-supporting.
Thank you. Thank you. Curtis, what do you think about location? What is important when choosing a location of a home?
So, of course, like they mentioned, proximity to public transit. Personally, my rules, a quarter mile. Well, 0.4 of a mile is like maximum, but closer the better to a bus. In an area where that's not drug infested, of course. For us, it's minimum 5 bedroom, 3 bath, fully remodeled, newer homes. We want to bring our people into nice places. We need to have adequate bathroom space and living space. Um, Being close to meetings, for example, Club 12, right, in San Antonio, they have meetings all day, every day. That's where everyone goes. So we kind of use that as a marker. Like we want to be, we want our people to be able to get there in less than 30 minutes on public transit and also be able to get to jobs pretty quickly. It's not reasonable to think someone's going to spend go to 5 meetings a week, spending an hour and a half each way, right? 3 hours a day times five. It's like a part-time job on the bus just to go to meetings. So, being realistic with that. And then the actual neighborhood, right? Is there an HOA? Is there not? Something that I learned that I should have done, initially is now when we get new houses, we'll go and introduce ourselves to all the neighbors, which I think is part of the NAR standard as well. But because we could have probably avoided a lot of trouble. We had some trouble with neighbors and we had to, send, lawsuits that happened in Houston to the city and get them because we had code enforcement and all sorts of stuff going on. But yeah, just being mindful of the area, not to necessarily avoid the HOA, but just keep the line of communication there, is really important.
Thank you. Thank you. Darren, you mentioned some things to consider. Is there anything you'd like to add?
No, I think y'all covered everything. I did think about maybe researching the other sober homes that are located around the area that you're looking at. That might be a good idea. I know that when we decided to open our home, there are at least two that are really close to us. And so you have to think of it as a business from a business perspective. Those are your competition, your direct competitors. And I was fortunate enough to be able to take a tour of one of them. And when I took that tour, it put my mind at ease because that home, really there was no comparison because there was room for 20 people over there. And I mean, they had like 5 refrigerators, and it was like a big time space compared to what we were going to be. So I was confident that with our smaller home, that we would be okay over there. But I think that it's good to probably check out your competition.
Sure. And, you know, you brought up a good point. Curtis, also about the HOAs and about the type of neighborhood and not being in one extreme or another. So you don't want to be in a very dangerous, drug-infested neighborhood, but you also don't want to be in a very strict HOA neighborhood. The reason being is the stigma exists, y'all. It is out there. And I ran an apartment model, and we found that when we rented these really nice apartments, they would rent to us, but the neighbors would complain, and anything that happened in the neighborhood, it was automatically the sober living's fault. Any vandalism, anything got stolen, anything at all, anybody speeding in the parking lot, they would call us and say, "Hey, we think this happened. What are you?" So a rule of thumb is just because you can doesn't mean you should. So fighting code enforcement, yes, you can. Fighting the HOA, yes, you can. But just because you can doesn't mean you should. So, yes, you can move into, and I had a provider that has lots of homes in the Houston area, open one up and had such problems with the neighbors that he was legally able to stay there because it did come to that, but he left anyway. Because nothing is worse than having your residents feel uncomfortable in the location of the home, one way or the other. So the best thing is try to hit that sweet spot. Find out who your population is. If you're serving a population with all women, some women with children, then be mindful of the neighborhood. Be mindful of the crime in the neighborhood, things like that. It is what it is. So great stuff. So the next question, and I'll toss it over to you, Darren, is where do you find residents? How do you fill your homes?
Oh man, that's a great question. Well, I have had pretty good luck with we have a website that is probably due for a little renovation itself. But it does have a landing page where people can put their contact information in, and I've gotten a good response from that. Probably our number one source of new people that are going to come in and live there. My house manager is very connected down in the community in Houston. He is a sober coach for the Montrose Center. He is on the board of directors for a clubhouse. He is out there really pounding the pavement every day. And he sees people that would be good fits for our home, and he's able to suggest that they come and at least take a tour. So we get a lot of that too. I'm also very involved with the clubhouse where we go in Houston, and so we have flyers up on the wall in the clubhouse because they allow that for us to put that there, and it has a little tear off sheet where you can call and get more information about our sober home. Um, those are probably the most activity that we get, where we get most of our people.
Awesome. Well, good stuff. And I'll bump it on over to Curtis. Where do you get your
Thank you.
residents from?
So us personally, majority comes from substance abuse treatment facilities. I call them and I want to talk to the case managers and discharge planners, go in there, meet with them, be clear what the requirements are, like make sure that, the people are completing successfully, that they have two forms of ID. If we are requiring a move-in fee at that time, I make sure to let them know that, or if we're able to work with them, we let them know that too. But yeah, working with a lot of different treatment facilities. And depending on like our requirements to come in, so we didn't always have this 30-day requirement, right? So there were detoxes that would send us people every day. You can get a lot of people from detoxes, but there's a lot higher turnover rate, with those people. So we had to, bump it up to a 30-day requirement, but there is a lot of potential from any outreach organizations, like here in San Antonio, like Corazon, CHCS, Haven for Hope, detoxes. Also, the court system. So the specialty courts, they will actually require people to go, and of course they have to be willing, but these particular people, so there's several specialty courts here in Bear County. There's like a mental health, a drug court, community court, which is formerly homeless individuals. There's family violence court. So there's all these different specialty courts, and going and meeting with those courts and those judges, those case managers. And a lot of them actually have funding. So we have a handful of guys in our sober livings. They come in and they pay the first 3 months. So those have been, some good networking. Of course, also from the clients themselves, they're always bringing people in. They bring in their friends from other places. So, yeah, that's where a majority of our people have come from.
Okay, cool. Thank you. Jennifer, you're last again. Sorry.
Uh, that's okay. Same as everybody, as far as that goes. We allow women to come in after at least 7 days sober. So sometimes because we work with women, they could be maybe coming out from, like a Genesis Center for Women from domestic violence. Sometimes we'll get a referral from CPS as well. A lot of times we'll have like relationships with hospitals that they maybe did a little bit of a stay for mental health, but substance use is their primary.
Okay.
Once they get stable from that program, they can come in, eating disorder treatments as well. Women, need to get more help with other things too. So as soon as they discharge, we just build relationships really in the community. I found when I was early in, and desperate to like get out there and meet everybody, it was off-putting because, you're just like trying to pound the pavement. But when you make a genuine connection and people really know you, the people that know you, right? So they will refer to you because they know you and they trust you by keeping your word. So, I think also keeping your word and being trustworthy will help you get some new people. Community service. So our thrift store, we offer community service and have relationships with, the courthouses around here. So if they want to come do community service, and then maybe that, and I've met with probation officers in Tarrant, Dallas, and Collin counties, and if they can't stay sober on their own, they can try our IOP. If they try IOP with no sober living, then they may need to say, okay, yeah, I can't stay sober on my own yet, but I do like you guys, and now I have a little bit of trust, so I'll try it. Um, we also have, like, I have a lot of other friends in the community or even past staff members that have gone out and opened their own homes. And sometimes maybe they're not a good fit for our program, but they would be for someone else and vice versa. So it's just kind of like collaborating with others. For us over here, you could look at it as competition, but there's not a shortage of addicts and alcoholics out there that need help. So we look at it as a way to collaborate.
Awesome. Thank you. And for me, when I was operating homes, a lot of the same. I made relationships with treatment centers, mental health, the local mental health authority, and some of those hospitals as well. And just getting out there in the recovery community is a big thing. Word of mouth is huge, and it works both ways. I was just talking with another provider yesterday, and they said, for all the good things that we have out there, we get we'll have one complaint that comes through, and then it spreads. And with the populations that we serve, um, everything's under a magic magnifying lens, if you will. And trust me, I house the state's grievance process for recovery homes, and I get some of the wildest accusations that come through from a resident who's typically being discharged that day or has just been recently discharged. Um, but yeah, that's why the connection thing that I mentioned earlier is important. Being connected to the recovery community, being connected to your niche market, to your specific level of experience. Um, so an additional question, and it came up earlier when Darren, you were talking about profitability. You know, if profit motivates you, then you're probably in the wrong business if that's why you're opening a recovery home. So before profitability, let's talk about sustainability. Tell me about some things that can help sustain you as a recovery home and kind of some suggestions. I tell people 6 months minimum to have 6 months worth of expenses in the bank before you open your home because, and really most folks say more than that. But surprisingly, Clean Cause Foundation and the and ARI, the Addiction Research Institute of UT, got together and did a sustainability project. And in their research, they discovered that a majority of providers do not have more than or do not even have 3 months worth of expenses in the bank. So they're living a scary existence of floating along, and you know the hammer could drop, and all of a sudden you don't have your beds full, or half your beds are empty for a month or two. Um, Darren, what would you say keeps Riverside sustainable through the hard times?
Yeah. Well, like I mentioned before, we save every penny that we can. And I'm also always looking for ways to save money on expenses. It's just like every other business I think that's out there. Um, I have a special need to keep this place going because we do provide a great service, and I know we do. And so there are times when we have it's pretty sparse at the house. And I know that when that happens, I need to double down and I need to be networking. I need to be out with the recovery community more. And of course, when we're doing okay too, I need to be out there just as much. But the more visibility that we can have, the more we try to tell people what we're doing, the better. Sometimes it does end up like a full-time job, but I think that for new people that are coming in and they're going to open a new home, you do have to know that you can't just stop by opening the doors. I mean, it's pretty much making those connections. It is making sure people know you're there, and it's a constant thing because there is turnover. And also, like you said before, Jason, I mean something can go wrong in that home, and you better get on top of it really quickly and get it fixed because it can spread like wildfire, and then you have a real problem on your hands. So I know we had a roof leak a couple months ago, and that's not fun. Roof leaks are not fun. Especially this house is a 1935 house, and I've replaced the roof, but it did have a roof leak recently that was caused by something that we figured it out. But um, I made sure that day that I was over there talking to the residents. I was talking to my house manager. I had a roofer on the way, and I made sure that we got that taken care of ASAP because it's something that does not need to be sitting out there. Like I want to make sure that people, when they hear about my home, our home, that they know that the maintenance is kept up, and we take care of all the problems that come up really quickly. So we make sure that the place is safe and comfortable for the people that live there.
Thank you, Darren. Curtis, same question. What keeps Mastermind sustainable?
Um, well, a lot of it's the structure. So like initially we would have people, we've had people owe like $1,800, but having certain rules in place, like, you need to have employment within 14 days. You need to you at 450 dollars they would get a financial contract. And it really comes down managing processes, not people, right? It's not personal. These are the expectations, um, and then on the other side, also kind of like how we network with the treatment centers, but also networking with employers, right? People that do a lot of hiring, maybe they have a high turnover, maybe they're using staffing agencies, right? Well, we can supply people that are clean, they have their ID, they're ready to work, and they don't have to pay us, and have those lines where we can just refer people. And instead of, you know, getting a job at day 14, then waiting 3 weeks for a half a paycheck. And, by that time they're already, pretty far behind. Instead of that, we can, offer a job nearly right away. They get in, start working, and kind of avoid the financial problems. So, yeah, those are some major things with Mastermind.
Thank you. Thank you. And Jennifer, you mentioned some of the events. Are those fundraiser events also?
Yes, for us fundraisers, specifically Recovery's Got Talent has always been um, the biggest fundraiser that we have, and that it's, not just about raising money, but also just raising awareness to what's available if people do need help. So having those relationships with treatment centers and business development representatives that want to sponsor, corporate sponsorships, corporate donations. Um, as a nonprofit, our one of our board members is a grant writer. I've learned how to write grants. One of my employees is learning how to write grants. And just having as much access to grants or funding, getting certified through TROHN and NAR has been big for us. We're also now Joint Commission accredited. So having the accreditation shows that, like, if we're going to be a high accountability sober living, we're also as a staff and organization willing to be held accountable to those high standards too. Um, and that we're taking that risk. If we're not doing what we say, there's many avenues to report, you
Yeah.
know, and many eyes that can be looking at it. Professional training and learning how to manage funds. Like for us, there was a lot of taxes that we were paying on services that we didn't need to be paying taxes on as a nonprofit. And spending, the 5 hours on the phone with Spectrum that it takes to get done what needs to be done, to be able to be resourceful. And, our thrift store brings us additional funds. Our IOP brings us in some additional funds. So yeah, I mean, we're working more this coming year on getting some corporate sponsorships. Now that funding has been cut for recovery housing, we, have lost the funding through Be Well Texas that we had, and that was a really big impact. But because we already had a sustainability plan, we just went right back to that plan and holding people accountable. The problem is that if you start off being so affordable that people send you those that don't have the ability to pay for themselves or resources to even start, your name is thrown in the hat of, oh, they'll help you, call them. And so building your reputation based on, yes, we are going to want to help everybody and we can work with most people, but we still have to pay the rent and the bills. So making sure that your reputation is what you want it to be from the beginning, and not because it's easier again to start that way than to have to come back up from low cost to, we're still low cost compared to what people are charging, but we do have that reputation of being able to help people because of grant funding and other reasons. So when we can't, it's hard to say no, but we have to stick to our word and stay true to providing for these women that we currently have.
Thank you so much. A model that I've seen that's worked for since the 1950s is the Wheelhouse in Deer Park, Texas. the Wheelhouse is an all men's, and it started out as a 30-day program, and then they built on and added what they call the three-quarter house. That's the next step, and that's up to 90 days in that. And now they've added on a sober living. They have a huge brand new building that's only been there a few years. And I asked the executive director about sustainability, and he said, we have a three-legged funding model. We have private donors or corporations. Said we have fundraising, which is they have like three annual events. One is a golf tournament. They do a theater night at the local theater, and they also do a motorcycle run with a cake auction. And they get such support from those fundraising that it covers a third of their expenses. Of course, the private donors cover a third, and the other third comes from the residents that are in the 90-day program in the sober livings. So if they were to take a hit in one of those areas, it wouldn't cripple them completely. So that's one of the things that I've always told people is make sure you diversify your revenue streams because all your revenue comes from the residents. Then you're going to run into issues whenever your houses are empty. And I love, Jennifer, you're probably going to get a lot of emails and phone calls about your grant capabilities, grant writing capabilities, because that's what everybody seems to be leaning toward is I want to get grants. But and I was joking. I know that it's a tough thing to navigate grant writing. I've recently written a couple this year for the first time, and it's we scored a 96 on a HRSA grant and still failed to get the money because it wasn't in the area they were looking to fund at that time. So it's not only how well you write it, it's got to be in line with what the committee is looking for. So good stuff on sustainability. I'm going to open it up for anyone with any questions. Now, I do want to mention we have Rachel Labus on with us. She is one of the TROHN board members and also operates a home now in Arlington. She was in Fort Worth. She's now in Arlington. So up there around where Jennifer is. And just wanted to say hello and make mention that Rachel is here. But any other questions right now? You can either put them in the chat or come off mute. I'll give you all a second.
Hi.
Hi,
Hey,
Rachel.
Jennifer. Thank you. Hey, Jason. Hi, Darren and Curtis.
Hey, girl.
It was awesome panel. I really got a lot out of it because I've been through it myself, and it's good to kind of hear, the same challenges. One thing I wanted to comment on and kind of ask, when you talk about higher standards, Jennifer, what specifically do you mean by higher standards across the board?
I would say the accountability piece for our women as far as like the behaviors that we expect to see change while they're living with us. We have write-ups, which is just like an encouragement to like, here's what you've done, here's another way you could consider doing it. Same for us, like one big thing for me personally is that I am just such a people person and I love love. So when I'm loving on these women, I'm there to cheer them on and help them out. But then a boundary can be crossed without even realizing it if you get too close. And, you just have to learn how to um, be supportive and helpful and let them lean on their community. So, stepping back when it's not my place. New lessons, right? I'm learning these things, but, the environment of care is one of the big standards with Joint Commission and making sure that those houses are up to standards, that they are fire inspected, that the safety of the house is like just looking at things that we wouldn't have thought of, looking at the risk and then being willing to make those changes and adjust. Just being held to the higher standards of, yeah, sober living is not really regulated in Texas. So you could be doing anything you want in there. Um, so we want to be held to that higher standard of care of like, this is based on the people that we are serving. based on our program, yes, but on what they want. We're not abusing them. We're being kind and doing UAs in a respectful manner. Little things that maybe would be overlooked and just not even thinking about, being held to a higher standard of care.
Thank you. I do want to ask Darren and Curtis a quick question. What what's your 10-year, 20-year projection look like? I mean, where do you guys see yourselves in like 10, 15, 20 years?
You can go
Well,
first,
I
Darren.
can. Okay, thanks. I would love to have this house stay open as long as possible. And I also would love to open a female home as well. That's been something that we have been trying to do since we started, and we've talked about it. So, as far as that's concerned, I think that we have the capability to expand. We just want to do it in a methodical fashion so that we know that we can be sustainable and it's not something that we're jumping into right away. There's definitely a need um, for that on in our community, and so we know that we could probably get one and keep it open, but we just need to make sure that we're doing it correctly and not jumping into it too quickly. So that's definitely on the horizon. But I would love to keep this house open for 20 years. So that'd be great.
Awesome.
All right, for Mastermind Recovery, so we just started with the and sorry, my lighting went out, so it's like really dark in here. So I just went back to the picture. But so we just started with IOP and PHP. We are currently looking for large, like maybe like retirement facilities. We're looking to open a 80 to 100-man sober living where everything is centrally located, where they have the case managers that employers are coming to pick them up from there. We're able to have large meetings there, where IOP and PHP all in one spot, along with peer support specialists. So we're currently looking for a spot. So when we can do that, and in 20 years, we would like to have facilities like that, multiple of them, maybe throughout Texas.
Wow, that sounds amazing. So we're rolling up to the top of the hour. I will say we have Pastor Christina Rodriguez on as well. And just for your information, Pastor Christina, everybody on this call is TROHN certified, TROHN accredited. And I know that you're taking those steps as well, uh, based on the wonderful introduction that Bethany has given us. So it's important, as has been stated, having a second tier of accountability, just like the people in recovery come, that's why they come to recovery residences, is to have that level of accountability. But for the homes in Texas, if they're not Oxford homes, then TROHN is that level of accountability that the providers have. And that's why it's widely recognized as a best practice by SAMHSA, by the federal government and state government, meaning that that's why they passed the Voluntary Accreditation Act in 23, is because it's not necessarily that we're managing each program, we're managing a system of accountability. And that's what the grievance policy is in place for. That's what the every 2 year application and visits to the homes is there for. It's to increase accountability. I have yet to fail someone's application. Now, not everyone that starts an application gets accredited. If it was easy, everybody would do it. But it's not a pass fail. We work with you until you achieve that standard. Once you achieve that standard, then you get your certification. One of the things I like to tell people is also new providers, it's better to start with the standards than try to adopt them later because it's a big culture shift for your leadership, for your residents to adopt the NAR standards and code of ethics. So if you start out with the standards, that's going to be your best path forward. Because although it's not required in Texas to be accredited in order to operate, it is required to receive any state funding. It's also required uh, at this time to get some of the protections that are out there. As Curtis had said, there's accredited providers cannot be called treatment centers, halfway houses. They can't be called group homes or boarding homes. That makes a difference with zoning laws. Because if your neighborhood is zoned to where you can't have group homes or boarding homes or halfway houses, then as an accredited provider, you can show them the law and say, I am TROHN accredited. I cannot be one of these things you're trying to say we are. So wonderful meeting. I appreciate everyone's input. Thank y'all so much for coming on here. And we're going to do this regularly for those of y'all out there. So we may have a different panel. Oftentimes on this meeting, it's every quarter. So the next one will be in January. And it's always on the fourth Thursday of the month. So we'll start in January and same time on the fourth Thursday. Invite people to come check this out. We've had Dr. David Best on here. We've had Dr. Amy Miracle on here. Some of the leading experts in recovery research will come on occasionally. Those are just a couple of the friends. I dropped their names because they're my most famous friends in this industry. So, I'll get them on every once in a while. And sometimes we'll have other programs that come on and highlight their operation and what they do. But check us out and always check out the TROHN Facebook page and the website, and we will keep everybody in contact. There is going to be a shift in our platform for the application. So if you're currently in the process of an application or have an application going through, it's not going to affect you. But we are switching to the Behave Health platform over the next few months to manage all of our it's called the affiliate management platform. It'll manage all of the grievances, all of the applications, and everything will move over to that platform. So they just got a big contract with NAR to do their housing directory, nationwide housing directory. So that's a big chunk. With you're talking about, probably close to 70,000 beds now across the country that are NAR certified. So. Um, Thank y'all so much. I appreciate you guys on the panel, appreciate your attendance, and I'm going to go ahead and say thanks a lot. I'm going to stop the recording.
Thank you,
You.
guys.